Hello and welcome to this week's What Were They Thinking? Among the various news items we have for you is random claims on Twitter by celebrities of side effects to various CCP virus vaccines. A man being turned away from many hospitals because they are so overwhelmed by the number of severe cases of the CCP virus, ultimately leading to his death. The interesting case of gorillas in an American zoo acquiring the CCP virus. This is one of the more recent animal species that has been infected by the virus in question. This year's Ig Nobel Prizes and the interesting winners and their various research topics. These and other news items are covered at the timestamps given below in the description. Let's start with the surprising medical expertise of Nicki Minaj. Or in this case, a less than expert and certainly not medical. They've claimed that there have been side effects from the CCP virus given to someone leading to testicular inflammation and later on claims of impotency. Neither of these are associated with any kind of evidence that supports the claims in question. And in fact it would be the only known report of it occurring. This has unfortunately led to Trinidad and Tobago wasting a lot of time chasing up this possible, rather important new side effect. The make-believe and imaginary side effect. The summary of the story is that she announced on Twitter to many millions of followers that they were avoiding an event due to a vaccine requirement, and that they had heard of a story related to swollen testicles. This came from a relative of theirs in Trinidad and Tobago. Naturally, the government in that country was immediately searching for this case of swollen testicles that would obviously be a major effect. The fact that the story was make-believe means that their health department wasted precious time and resources chasing up a non-event. Time and resources that could be put towards, say, vaccinating more people, or helping those who are actually sick with real diseases or side effects. Sadly, gullible idiots amongst the anti-vaxxers have jumped on this newest story as an example of evidence being hidden and other conspiracy theories. The reality is, no, it's just a bullshit story. There is a certain irony to it though. There is some evidence that the CCP virus will affect your testicles and reproductive ability. The vaccine would obviously benefit you by protecting you from that particular effect by reducing the severity and duration of infection. To a certain degree, celebrities should keep in their lane, in a manner of speaking, by not trying to spread misinformation and certainly not information that they can't verify or can't explain some sort of mechanistic way for it to occur. In this case, there is no reason why the vaccine should cause swelling to the testicles. It's the same reason why nutjobs who claim that the CCP virus vaccines are causing spontaneous abortions are just as equally full of nonsense. This is the same sort of group that claims the human papillomavirus vaccine was affecting fertility. Again, without necessarily providing the kind of evidence that's needed for such a miraculous claim. While the group behind the article in question did not use the most robust possible methodology, they are relying on a very large dataset. In this case, over 105,000 pregnancies. These numbers are important. Over 100,000 individuals, or at least pregnancies, is a very large number. Of these 105,000 people, 13,000 had spontaneous abortions and 92,000 had completed their pregnancies. Note, we're using rounded numbers here, so there is going to be some inaccuracy in the totals. When you start breaking it down, of the individuals who had the spontaneous abortions, 7.8% of women received one dose of the Pfizer, 6% Moderna, and 0.5% of the Johnson & Johnson vaccine in the 20 weeks prior to gestation. They then looked at the numbers for those who had received a vaccine in the 28 days either before spontaneous abortion occurred or when pregnancy came to completion. 8% received one dose of the CCP virus vaccine. Of those who received the vaccine, 8.6 had spontaneous abortions. That figure wasn't any higher than the relative risk for those who had received it in the 28 days prior to pregnancy. That means there is no significant difference between the two groups. Vaccines do not pose a risk, at least according to this study, for women who are pregnant. This is nearly always the case with something we have a vaccine for. It's not the vaccine, but the disease that is a problem. And in this case, we have the story of an Alabama man who died after being turned away from 43 hospitals. That is 43 hospitals that did not have a bed available because the ICU was full with CCP virus patients. This is an otherwise avoidable situation through one simple thing: vaccinations. It's the reason why we don't have wards full of iron lungs with children and adolescents suffering from polio. Vaccines. A simple enough word to say, but seemingly a very hard thing to get into people's arms in America. In this case, in order to find a hospital that could take him in, he would have to have been sent 200 miles or 360 kilometers away to a hospital that had a free bed. The delays in getting him the possible transfer to a hospital where he could get the needed care led to his death. ICUs within that nearly 400-kilometer radius were all packed full of patients. This is a throwback to the first days of the CCP virus in America, and in fact in other countries, where places like Italy were literally having to triage patients on the basis of the chances of their survival both in the short and longer term in order to decide who would get a ventilator. America is now falling into the same problem these other countries had a long time back now in relative terms, in an entirely avoidable situation. Numerically, there are 60 more patients who need ICU beds at the moment than they had capacity for a week ago. This means they're having to open up new beds, try and find the materials, resources, and equipment to run them, and this number that needs those beds is only growing. Among the cohort who is creating the most problems at the moment with regards to vaccines are inevitably the anti-vaxxers. Frankly, idiots. Not just because of their belief though, their actions at the moment are also stupid. They're throwing fireworks and garbage at Colorado clinics. Unfortunately, this is forcing them to shut down. These are just some of the more blatant acts of aggression and vandalism by anti-vaxxers. They've also driven cars onto curbs, hurled liquids onto nurses, run over signage, and screamed profanities at staff who are just doing their job. And this is perhaps where anti-vaxxers cross the line from simply being stupid to being incredibly bad people. You're free to hold your beliefs, and in holding them, suffer repercussions for having held them. In the case of anti-vaxxers, more extreme cases of influenza, for example. In other cases, their actions here are not just an enactment of their belief, but causing harm and threatening the lives of others. These actions have forced the health authorities to pull out mobile vaccination clinics and vans that were able to deliver shots to people's arms, either those who were unable to travel to clinics, or those who were in isolated communities. No matter how you cut it, the behavior is reprehensible. Going now from humans and weirdness there to our close relatives, gorillas, and the way that they've now been infected with our mess in the form of the CCP virus. Gorillas in the Atlanta Zoo have been testing positive for the CCP virus. This isn't all that surprising. They do share much of our genome, and so having a similar enough, if not the same, particular receptor that the CCP virus takes advantage of means that they are vulnerable to being infected if one of their carers or attendants happens to have the particular virus at the time and is contagious. The gorillas are being given monoclonal antibodies to help them deal with the virus. The concern is how they got infected. There were some pretty stringent protocols to ensure the apes weren't infected, and yet they have been. The current theory is that there was an asymptomatic keeper who somehow managed to infect them. This is a slight hiccup, although again not surprising, since most of the staff have been fully vaccinated. This means somehow they have been infected and they aren't showing, or at least aren't aware of symptoms enough to be able to put themselves in isolation. What is also more concerning than that is that somehow or other they've broken protocol enough that they've managed to mitigate the benefits of wearing full PPE. Going now from animal news that's somewhat disheartening to animal news that is somewhat weird. When you look at various worms, and we're not talking about ground worms here, but rather worms in the form of parasitic organisms and nematodes, they're not very complicated. Somehow, though, they still manage to impart knowledge to each other. We're now considerably closer to understanding just how they do this. It appears that they can share memories by exchanging RNA. What happens is that as the nematodes die, the RNA leaks out of their body, and a passing member of the same species can pick it up and incorporate it into their body. And from this, they can, to a degree, incorporate the memory of the original nematode. This gets more interesting when we look at just how the nematodes can pick up and retain this memory. In the form of humans, we need to pass on knowledge and memories, for the most part, through either oral histories and learning, written text, or some other form of communication. Nematodes obviously lack this particular methodology. They're, after all, small worms. The only way they can do it is similar to some things we have seen with humans, where certain genomic changes can be passed from mother to offspring in the form of acquired changes through life experiences. The way the nematodes do this appears to involve a gene called SIR1. If they remove this particular gene from the nematodes, they were unable to incorporate this RNA and thereby pass on their experiences. At least in one study where they looked at the effect that ingesting an otherwise unpalatable organism had on the flatworm. While there is all sorts of amazing research like that going on, every year there's also research that is less groundbreaking, or at least less noble in its pursuit. And for this reason, since 1991, an annual prize has been awarded called the Ig Nobel Prize. This particular event takes a number of good-humoured and light-hearted potshots at the Nobel Prize by somewhat satirizing it, or parody. Let's take the winners for this year as examples. One looked into cat-human communication and the various sounds made. One looked at the bacteria that were in wads of discarded chewing gum. Chemistry was in analysing the air in movie theatres to figure out what was going on in the movie theatre as far as the audience reaction. The Transport Prize is for investigating whether or not it is safer to transport a rhinoceros upside down or not. In economics, whether or not the more obese a country's politicians are, whether or not that indicated the greater corruption in the country's government. In medicine, whether or not sex could be an effective decongestant. And for the Peace Prize, whether or not humans involve beards to protect themselves from being punched in the face. These research topics may, at least on the surface, appear to have no great merit. After all, what benefit is there in exploring whether or not a rhinoceros should be transported upside down, or if a beard will protect you from being punched? By themselves, they may not have the same prestige as Nobel Prize winners, but they are possible significant steps towards a greater scientific discovery, and these small, otherwise unnoticeable processes are what are needed to get to those grand prizes that are the Nobel Prize winners. The final news item for this week is something just as weird and wonderful, but not that's been given an award at this stage. Something has just hit Jupiter and caused a rather bright splash. The event was noticed by a number of independent astronomers in different countries, everywhere from Germany through to Brazil. The video footage, which we'll link in the description below, shows something hitting Jupiter and causing a bright white flash on the screen. This would appear to be something quite large, and quite possibly the 8th such event to have occurred in recent history. It's worth noting just how far away Jupiter really is. At 618 and some million kilometers from Earth, whatever we're seeing hit it has to be pretty big and has to be making a real splash in order to be visible. That amount of light isn't something that's easily seen, and especially not from Earth. That's all the news we have for you this week. Thank you for watching. If you have found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions that you have below